Hi, my name is Greg Feld, Director of Public Health in Sheffield. This is the COVID Epidemiology and Update Report of the 28th of February. We'll do epidemiology first. Slow drift, in a word, downwards. The testing data that we've got actually is no longer very reliable, so we move back to the ONS Community Infection Survey, which has been one of the critical sources of epidemiology throughout. Reasonably quick fall in case rates, and you can look on for the ONS infection survey yourself, but as of last week the prevalence was 3.3% of the population, so there's still a lot of COVID out there, but going down reasonably quickly. Drift down in hospitalisations. There still are people who are poorly enough to be hospitalised, and there'll be plenty of people poorly enough to need to be off work or school or whatever, so COVID's still out there, but drifting downwards. Case rates drifting down pretty quickly. Hospitalisations will drift down a good bit slower than that. Undoubtedly the Omicron surge is kind of waning now. It's a pretty big surge and it lasted a reasonable length of time, but it's waning. Further big surge this side of summer is very, very, very unlikely. For the dorks amongst you, if you want to read how this plays out, I encourage you to look at the SAGE papers on viral evolution. So you'll all have heard the Prime Minister's announcement of last week on the Living with COVID plan that was published, 60 odd pages, and I'm sure you've all read it. The key bits is this. Firstly, self-isolation. So as of last week, there's no longer a legal requirement for you to self-isolate if you have COVID symptoms or test positive or a close contact of a positive case, regardless of your vaccination centre. I think you'd still be advised, and I would advise you to stay at home and avoid contact with other people for 5 or 6 days. It would be advisable that you do a lateral flow device test on 2 consecutive days, and if both are negative, then it's pretty unlikely you've got the virus. Please register your LFD test results. Lots of people haven't registered them, but it's really important if you do an LFD test that you register positive or negative, because it's one of the better ways of tracking the epidemiology. But although you're no longer required by law to isolate, basically don't spread your respiratory bugs around, because there's a lot of other respiratory bugs around at the moment. Some of them are quite nasty. I've had one of them. Keep away from others if you do test positive or have symptoms, especially if you're mixing with the elderly or those with underlying health conditions, who are those that are most likely to be seriously affected with COVID. PCR testing is changing, and it will change quickly over the next month or so. It's expected PCR testing for the general public will end on the 31st of March, so you won't be able to book a PCR test if you have COVID symptoms from 1st of April onwards. Until then, if you have symptoms, take a PCR test. Contact tracing is being wound up and has ended, which means you no longer have you will no longer be contacted to book a PCR test if you've been near somebody who's tested positive to COVID. There will be some people who will still get priority access to PCR testing, particularly for those who are in high-risk groups. As I say, that will change pretty quickly over the next month or so, and we'll keep you posted on that one. As from when it was been first available, the greatest defence is vaccination, which has done us wonders and a service, and it's more important now than ever. If you've not been vaccinated, please do so, and there are still lots of people who've chosen not to. I'd encourage you to rethink those choices. There's still several places across the city where you can get vaccinated, and it's never ever too late, and more information available at the end of the video. Then lastly, on the how I think it plays out, I think we'll get to, this is where it's an endemic illness, a low rate, stable, predictable. I do think we're a long way from that yet. There will then be the occasional flare-up. Now and certainly into the future, we'll see more medical and countermeasures that will prevent harm from the virus. So the key point is the unpredictability of variants. There will be more variants of COVID. It's impossible to say when, where and how they will emerge, but they will. There are 2 extremes in terms of moving forward, 2 camps. There's one camp which is sort of, this is nothing but a sniffle, pull your socks up, get on with life, and the second camp is the government has taken all the brakes off, and we should be in plan B forever. Neither of those two is the correct interpretation of the future, in my view. I'm well aware that the media, both social media and print and broadcast media, is polarised on the matter. I will walk the middle line on that one, and I will put people right when things are obviously wrong, but I am of the mind that we do need to get back to normal in careful, measured steps. We need to learn to live safely with COVID. So there will be another variant that will change it all at some point. I don't know when that will be, but that almost certainly will happen. There's a narrative I hear a lot that the virus will evolve to become milder and milder and milder. It's not true. There's no evidence in viral evolution that is the case. The next variant may well be more severe than Omicron. It may well be more severe than Delta that preceded Omicron. So we just need to be careful about that one. And that will happen. So I think things that we can do and what we are doing. So outdoors is pretty safe. So we should try and make indoors the same as outdoors. Ventilation really matters. There's a large infrastructure issue there, but there are plenty of things that we can do, such as opening the windows, just getting circulating air into rooms. Vaccines remain crucial. The world will need to be vaccinated to make this illness truly endemic, but clearly we will continue to vaccinate people as we go forward. We know that acting sooner rather than later is crucial, so we will continue some form of epidemiological surveillance that will enable us to spot COVID variants when they arise. We have routine surveillance for lots and lots of other illnesses in this country, and we integrate COVID surveillance into that. We still don't know as much as we need to about the long-term impacts of COVID, but they are there undoubtedly. And lastly, we know that COVID has hit the disadvantaged the hardest, and it's shone a spotlight on structural inequality like never before. Well, let's not take that spotlight off, and let's continue our focus on that one and work out what we can do to solve some of those structural issues. Easy for me to say, very difficult to do, I know. But we know how to live safely with COVID. We're getting to the stage where we need to learn to live safely with COVID, and that's what the next few months will look like.